In mid-2010, at the age of 69, our mother was noted to have a fairly paroxysmal onset of confusion and memory loss. She subsequently underwent a series of tests in October of 2010, including CT and MRI, both showing some generalized atrophy and ventricular prominence out of proportion to the degree of cortical atrophy, possibly representing a component of normal pressure hydrocephalus, a treatable cause of dementia. The triad of clinical symptoms are described as wet, wacky, and wobbly, representing urinary incontinence, dementia, and ataxia. Clinically, she had definite dementia with reported occasional urinary incontinence, but no real gait disturbance. This prompted a series of tests in November of 2010, including an LP with drainage of CSF and a lumbar drain, both of which provided subjective and objective improvement in memory and recall with cognitive testing by speech pathology. Relevant pre- and post-procedural Ross Information Processing Assessment, or RIPA, results after lumbar drain placement as follows. Delayed memory task, pre-procedure 33%, post-procedure 100%. Immediate memory task, pre-procedure 54%, post-procedure 82%. Temporal orientation, pre-procedural 59%, post-procedural 98%. Spatial orientation, pre-procedure 71%, post-procedural 92%. Auditory processing, pre-procedure 69%, post-procedural 91%. Each of these interventions were performed with IV Versed and fentanyl for sedation and pain control. These encouraging results prompted placement of a definitive VP shunt on 11/15/2010 with disappointingly little improvement in cognition over the next few days. Concerned for shunt malfunction, Mom underwent a shunt evaluation on 11/19/2010 demonstrating shunt patency. 22 cc's of CSF was removed and she received 4 milligrams of Versed and 100 micrograms of fentanyl IV for conscious sedation and pain control. Again, she showed marked improvement in short-term recall, but the effect was short-lived and within a few hours was back to baseline. Because of her situation, Mom has been relegated to a nursing home since 2011. In September 2013, Mom underwent a minor in-office procedure with a local maxillofacial surgeon. Utilizing IV Versed, the procedure went smoothly without complication. Our sister visited her immediately post-op and was impressed at her cognitive abilities, specifically short-term recall, and declared her the best she had seen her in 3 years. The billions of neurons in our brains allows us to think, learn, remember, and move. Each of these individual cells can connect to between 5,000 and 200,000 additional neurons and communicate with one another through small electrochemical gaps called the synapse. The architecture of these connections are variable and complex, including axodendritic, where the axon of the first neuron communicates with the dendrite of the second. We can also have axosomatic, where the axon of the first communicates with the cell body or soma of the second. There is also axoaxonic, where the axon of the first communicates with the axon of the second. When an electrical pulse reaches the end of an axon, it causes small chemical-containing vesicles at the end to fuse with the cell membrane, degranulate, and spill their chemical content or neurotransmitter into the gap where they deposit on the postsynaptic cleft of the next neuron. Once a sufficient amount of chemical is present, a threshold potential is reached, causing a new electrical pulse to propagate down the next neuron. There are over 100 known chemical neurotransmitters in the body. Most of these are excitatory, causing the next neuron to fire in their presence, while a few, predominantly GABA or gamma-aminobutyric acid, are inhibitory, preventing the neuron from firing in their presence. Versed, or Midazolam, is a benzodiazepine used for moderate sedation for various in- and outpatient procedures. One of the effects of Midazolam is antegrade amnesia, where patients cannot recall current events even minutes after they occur. These effects are thought to be mediated through the selective enhancement of the GABA A receptors in the brain. GABA is an inhibitory neurotransmitter that is thought to block the transmissions along the limbic pathways by increasing the threshold potential of the postsynaptic cleft and making it difficult for the cell to fire. The hippocampus is part of the limbic system and is involved in memory formation. Again, Versed and other benzodiazepines produce their effect, including antegrade amnesia, by enhancing the action of the inhibitory neurotransmitter GABA, thus stabilizing the postsynaptic neuron and preventing transmissions along the limbic pathway and hippocampus. Mom has a baseline antegrade amnesia associated with her disease process that seems to be temporarily alleviated or mitigated after Versed administration. Could this be a rebound effect associated with the temporary upregulation of the stabilizing chlorine channels along the limbic pathways? If so, could selective GABA-A antagonists like flumazenil or romazicon provide a similar but more sustainable effect?